Good afternoon, everybody. Let's call the Mason County Board of Public Health to order, please. First item on the agenda is again a welcome. I think we all pretty much know each other, but why don't we, Terry, why don't you go around this way and we'll pick up our visitors as well.
Okay, Terry Drexler, Mason County Commission.
Peggy Van Busker, Costville District 2.
Kevin Chudy, Mason County Commission.
Scott Hilburn, Mason General Hospital Commissioner.
Dave Wyndham, Mason County Community Services Director.
Diana Yu, Public Health Officer.
Lydia Buhite, Mason County Public Health.
Audrey O'Connor, Public Health Nurse.
Allison Smallwood, Mason County Public Health.
Christina Mullershin, Mason County Public Health and Community Services.
Dave Gardner, Mason County Public Health. Bo Bach and North Mason Regional Fire.
Sean McGuire, Environmental Health Specialist, Community Services.
Cody Lund, Environmental Health Specialist.
Wendy Jonas, Environmental Health Specialist.
Alex Pacey, Environmental Health Specialist.
Debbie Riley, Environmental Health Manager.
Just Tom Davis.
Okay, thank you for joining us. Next item on the agenda is the approval of the agenda. Have you had a chance to review it? And
I make a motion that we approve the agenda, but I think that Dave wanted to add one thing.
yes, he did. We should go ahead and consider adding Resolution 3318, probably right in after the minutes.
Okay, so.
So, would you like to make a motion that we amend the agenda to add 3318 resolution there?
So moved.
Second.
All in favor?
Aye.
Motion's carried. Thank you for amending. Approval of the minutes. Have you had an opportunity to look at the minutes from our last meeting of March 27th?
Did. And Mr. Chair, I
Do we
move
have
the.
a quorum?
Do we have a quorum?
Yes.
Yeah, I think
Okay.
so.
Yeah,
Yeah.
with you, it adds one. Okay, yeah, we're good. Okay.
You want to leave early, don't you?
Well, that's why I want to make sure we get it up front.
Yeah. Good
Yeah,
question.
4 is enough.
Got the resolution.
Pardon?
I think 4 is enough, is what we.
Yeah, quorum is one county commissioner and 3 other members.
Good.
Okay. Mr. Chair, I move the approval of the March 27, 2018 minutes as written.
Thank you. Second?
I'll second that.
Any further discussion? If not, is there a...
There actually was one little thing that, the 4th page, I think that, that statement should be put under the bullet points.
Okay, page 4.
It says, Commissioner Drexler stated that it just doesn't make sense where it's put, because there's that little thing about you asking an opinion of where should we go. And it's really one of the county health rankings bullet points like all the others.
But actually it wasn't. We were having a
Wasn't?
no.
Well, it doesn't make sense the way it reads, so I don't know how you want to make it to make sense. How would you like it to make sense? It doesn't really make sense.
Probably, knowing me, it just came out of the blue as a different data point to consider when we're thinking about the health of the community. We're talking about unemployment, and frequently.
For clarifications, why don't we go ahead and leave page 3 the way it is, and on page 4, the front page, make
Maybe it
number
should-
9 and make 9, 10, make 10, 11,
There you go.
move it all down one
Okay,
number. Does that
that
work?
sounds good.
Okay.
Okay, minutes are so modified. Melissa, you follow all that?
Yes.
I don't know why, but you
Yeah.
good, thank you. Is there a
Okay.
second to approve the minutes as
Then
amended?
I can second that, or somebody else might have already, I don't know.
Good catch, Peggy, thank you. All in favor of approving the minutes as amended, signify by saying aye.
Aye.
Aye. Coming back to Resolution 3318, who would like to,
I'm going to hand them to you so you have them.
who's going to present that? Lydia, is that?
I guess it's me.
Is Dave going to take that one,
Or either of the commissioners could as well, because they know about it. This is the resolution establishing a Mason County Housing and Behavioral Health Advisory Board on housing and homelessness, mental health, and chemical dependency treatment. And it just got approved by the commission last week. And what's on it is also how it's formulated, one of the board members is a Board of Health member. So we're wanting to bring it to the Board of Health so they can kind of talk about who they might want to put on that board. It does say in it on the 4th or 5th whereas that it can't be a Board of County Commissioner. So anyway, take a look at it, and we just didn't want to wait 2 months because we're trying to get that board up and running.
Sure.
We need that board operational.
Lydia, when that funding program was voted by the public to support that initiative, wasn't there a...
There was an advisory board that was put in place
Uh-huh.
that had a specific task as to what to do, and they accomplished that task, and then we ended up having a problem where all of the people attending the meeting any further was only recipients of the funding, and there were no public board advisory people coming anymore. So we dissolved that, the commission dissolved that board back a number of years ago.
Okay.
At this point, we're incorporating it. It's a little broader because it's including housing, because there's a lot of cross between those, and that board before did not have housing involved. And this will help watch the priorities, and this group would be helping advise the commission on where funding, like what priorities funding might go to for housing and also mental health, behavioral health work. So.
Okay. Any idea of the time commitment?
I think initially might have a number of monthly meetings to get up and running, and then it'll probably move to a quarterly and then semi-annual. I don't expect it to be a lot.
You okay with that?
Yeah, I'm okay with that.
Thank you, Peggy. We were talking before, when this was coming up on the agenda, who we were going to go ahead and suggest take the position on the Board of Health. And I suggested Gary because he wasn't here.
Gary would love that.
Peggy backed away because of the commitment, but I think she's now sees an opportunity to participate in that. So, Peggy, thank you for
Yeah,
that. Let's any other questions on the resolution before we take one step at a time here? Is there a motion to approve Resolution 3318?
No, you're actually approving.
The county commissioners already did.
Yeah,
So-
you're
Thank you.
approving only
Thank
who
you.
you
Yes.
want the board member to be
Yeah,
representing.
I still have my hospital hat.
Mr. Chair, I move that we nominate to the County Commissioner Peggy Van Vesper as the Board of Health representative to the Mason County Behavioral Health Advisory Board on Housing and Homelessness, Mental Health, and Chemical Dependency Treatment. And what's the acronym for that?
Second. We have a motion. Any other discussion? Hearing none, all in favor of the appointment, signify by saying aye.
Aye.
Motion's carried. Thank you, Peggy.
Thank you, Peggy, appreciate it.
Thank you.
I know you've got a busy...
Yeah,
busy
I'll figure
life.
it out.
What's nice is you had a commissioner nominate and second you, so that kind of helps on the second. So.
Let you have the outside one.
I appreciate it. Sign it the next time.
Let's do it next.
We'll give it back to you.
Yeah, and make it prettier.
Afternoon, Wendy. We are on environmental health, number 5, environmental health.
Thank you, and I'm sorry I'm going to be standing with my back to some of you. Every Board of Health meeting, the managers submit a from the desk up. And since this is my last one, I wanted to take a few minutes and read it into the record. It's a slightly different version than what you have, but I had some things I wanted to do, so I'm using this forum. I've been in public health for about 19 and a quarter years now in Mason County. I'll have been in public health for 30 years in a month when I retire at the end of June. So that's kind of where I'm coming from. I'm here mainly to honor the field staff that do all the work. They keep the county running and make all of us look good. It's been quite a ride. We've had some really good times. We've had some really lean times. But what gets us through all of those times is the day-to-day work of these folks. They're often overlooked and sometimes treated poorly by the people they're working to protect. But they come to work every day and do their jobs to the best of their abilities. I wish people could see what I see when I walk into the office every morning. Hardworking, committed people. I've never worked with a more dedicated group of professionals. I want each of them to know how much I respect the specialized work they do. I'm really proud of the progress we've made and the things we've accomplished. The section is in transition as I leave. 2 of our 7 environmental health specialists have left within the last 6 weeks, so we're in the process of rehiring those positions. When I came here on March 1st, 1999, the only thing I knew about shellfish was how tasty they are with tartar sauce, butter, or cocktail sauce. Where I came from, the only oysters we had were Rocky Mountain, and we're not going to go there. My learning curve for marine water quality was a vertical line. I knew absolutely nothing. Most of the people I worked with were very kind and shared their knowledge with me. I learned so much so fast and helped bring Mason County to the forefront when it comes to doing a lot of meaningful work with very little resources. I worked really hard to bring grants to Mason County to do the work that needs to be done. In 2003, we received an Award of Excellence from the Washington State Public Health Association for significant contribution to public health. It was for, and I'm quoting, diligent work in finding and correcting various sources of pollution in watersheds that drain to commercial and public recreational shellfish growing areas, end of quote. Yeah, we cleaned up some water and got some shellfish area opened. In 2012, we received a Model Practice Award from the National Association of County and City Health Officials. It was for our innovative Oakland Clean Water District work. It was a water quality model. We submitted it for consideration, and it was accepted, and our poster was on display at the National Conference in Los Angeles. That same year, we got an award from the Puget Sound Partnership for education and outreach work that was done by Mason County and our partner, Mason County Public Health and our partners. And that's one of those traveling sort of awards. We had it for a while, then it went to WSU Extension, and I think the Conservation District ended up with it because we were all part of that. So it's kind of cool. It's on a piece of bark. We'll find it someday. I got to not only be the face of Mason County Environmental Public Health, but the voice as well. I lost track of the number of times I was invited to speak on the radio at KMAS. Diedrich was one of the first people that I talked to down there. I used the opportunity to get the word out if we were working on a project or wanted people to protect themselves from West Nile virus, to know why we shouldn't use additives in our septic tanks, or to give instructions on how to bring a bat in for testing, just to name a few. The local media served us well over the years. I was very active with the Washington State Environmental Health Directors Group, and I was the statewide chair from 2004 to 2005. That is a 3-year commitment, so they didn't get rid of me before I became the chair. For many years, I was the chair of the Zoonotics Disease Committee and sat on the Legislative Committee, often testifying before a House or Senate subcommittee about on-site sewage and water quality. Most of my contemporaries have retired, but we have a new young group of directors around the state that will carry on all our lessons into the future. I'll miss my group of peers. They understand what I do and what that means. Sometimes it's cool being one of 34 environmental health directors or managers around the state. Sometimes it's just flat terrifying. Most of all, I'll miss the people I work with. From the staff throughout the county to the members of my department, they're a great group of people. I'll miss the employees of the environmental health section. Each one is a member of a very small group of highly trained technical specialists doing what nobody else can. They're young and they have limitless potential. Remember just how special they are. They are my legacy to Mason County. Although everyone on the staff is cross-trained to work with other programs, each of them has taken their assigned program and made it their own. See, they weren't privy to this before I asked them to come over for the meeting, but I'm going to ask them as I talk about them to stand up so you see who this is. Alex, He stepped up and filled the appointment of lead worker with enthusiasm and professionalism. As our Department of Licensing Designers license holder, he's training new staff to work in the on-site sewage program. He's taken on the Group B drinking water program, which is a partial delegation at this time. He's updating our policies and procedures, and he puts his graphic arts talents to use on our publications. He's a great role model for the newer staff.
Thank you,
And
Alex.
Katie has focused her water quality work on Hood Canal after finishing up the huge Open Bay project. She stepped up and accepted the Vector program, working with a CD nurse and Dr. Yu on animal bites and all the investigation that goes with it. Katie's a talented facilitator and has led many of our public meetings. We just learned that 350 acres of Oakland Bay growing area are being upgraded because of the work that's been done. Got that on Friday.
Thank you, Katie.
Okay, and Stacy isn't here. She'd taken on the Hammersley Inlet grant work, looking for the source of the norovirus outbreaks, closing shellfish harvest during the winter, as well as doing some maintenance work in Oakland Bay. She left us at the end of April to work for Kitsap County Health District. Her husband, who was a teacher at North Mason, took a job with Central Kitsap, so they're moving up there. It made sense, but the sad thing is Mason County lost 2 professionals in that move. So, Sean, he'll be finishing up the Hammersley Inlet work. He's learning on-site, handling the phone calls that come with our periodic mailings, and that's a lot of phone calls, and following up on many on-site sewage complaints. He's taken on the shellfish biotoxin collection and beach programs.
Thank you, Sean.
Wendy, there you go, is immersing herself in the on-site sewage program, performing field work, permit review, and what did I do?
Immersing herself in the You don't look it.
Oh, that was truly unplanned. And she approves the building permits too. She's working through her, I can't look at you. Department of Licensing, Designer Licensing. She brings laboratory experience, a background in sewage treatment plants, and military experience.
Wow.
So thank you.
Thank you, Wendy.
Okay, Cody. Cody's taken the food program to a new level for Mason County. He is participating in the Food and Drug Administration's Food Standardization Project. He wrote 3 federal grant applications and got 2 of them funded. One was for him to travel to an FDA training, and the others to support the formation and implementation of an advisory committee. Cody's taken on the well delegation program, inspecting new well construction for the county. He is also performing the 2-party well part of drinking water. Cody's training is as a health educator, and he uses that training in the community. He also does our water recreation program, inspecting pools and spas in the county during the season, and that's starting up. So thank you. Maria made the solid waste program her own. Her direct but compassionate approach has gotten cases that have been open for years closed. Because the state funding for her program got tied up in the capital budget, she took on the Group A sanitary survey program to fill the void. She learned it quickly and completed the tasks left when the previous staff person retired mid-year last year. Maria also backed Katie in the Vector program. She left us on May 18th for a job in Thurston County's solid waste program. We'll miss her. So we'll be interviewing candidates for our 2 open positions starting this week. The current staff will take them under their wings, teach them their jobs, and help them be successful. I know that's true. My job is currently being advertised. And we'll be reassessing the existing workload as the new staff come on board and making those adjustments. We also support nearly 2 clerical positions. Shelley performs our scanning and records requests tasks, and Kim does data entry for the food program, receives and receipts permits, sends out our mailings, and is our face to the public. We're so lucky to have this amazing staff on board. They'll carry on my vision of environmental public health, and for that I am hopeful as I begin the next phase of my life where every day's Saturday. So thanks to them. I appreciate them. Mr. Chair, that's my report.
Thank you. Thank you, Debbie. Just thinking back, your comments about starting in the position, accepting the challenges and growing with it. I can personally attest to that from the outside community. You know, you've grown, the department's grown, and consequently, the public that we serve has grown. So thank you for your service.
Well, thank you very much.
Dr. Yu, anything to report?
Oh, I just have a brief report, and actually feel free to chime in because both you and Peggy, Commissioner Van Buskirk was also at the meeting. I attended a meeting at Mason General at the beginning of this month, and it was for the formation of the Mason County Healthcare Coalition. And this was a group that was formed basically by all the folks in the community that provide health care within this community. And so we had the public hospital districts involved, Peninsula Healthcare from up in Belfair, and then Mason County Public Health was included. We also talked about who was missing at the table, trying to just get to know each other, trying to figure out what our strategies were, what our goals were, what our purpose for being was, and just get a much better understanding of where we're all coming from, because we all need to work together for the health of this community. So there is, and unfortunately this came this morning, so this is the minutes of the meeting, and I will have, we'll be sending that out so that you can take a look. It's actually interesting to have all of us align and say, you know, what's our purpose? What are we doing here? What are our goals? One of the things that I found very interesting is where we're headed. So Mason General is consciously actually moving away from directly working on social determinants of health. Issues on social determinants of health, for example, housing, things like that. So they're trying to get away from overextending beyond their hospital walls. So trying to do a much better job in continuing to focus on what they do best, which is providing good health care for our community. On the other hand, Peninsula Health Systems came in and was saying that, you know, they're reaching beyond their boundaries of where they thought they would be. So they're actually going outside of their clinical walls and getting involved in things in the community, like the work with the opioid response plan, and doing a lot of work in that arena. So it was very interesting to see where everybody was coming from. We identified other partners that we felt need to be at the table. One was the tribes and tribal entities, because they also provide a significant amount of health care for the tribal members in our community. And then we also talked about other groups like schools. We were not quite sure where it was going to fall. We were still in the discussion stage about where we saw whether we wanted to involve dental providers. We also saw the need for bringing in not just the administrators for the hospital districts and the clinics, but also the medical, the clinicians, medical directors. In the involvement of EMS and fire, which although they don't provide direct patient care, they are a natural conduit between the healthcare community and the members in our community, and they're an integral part in that one. So the plan is to continue to have these meetings, and wanted just to make you aware of what is going on in that arena. I didn't arrange or call the meeting. It was facilitated by Winfried from Choice Regional Health Network, and it aligns very well with what is going on the regional level with the the accountable communities of health work. So it's like dialing that down to our community. It also allows us the opportunity to collaboratively work on things like grant funding that's coming up. So there's going to be an RFP that's going out, I think tomorrow.
30th of May.
30th, no, next week. It's going to talk about funding that's coming through the accountable communities of health. We could all compete and try to get chunks of that money, or we can all work together and try to figure out how we can take different pieces of the action and work on our community together. So that's all. And if you have questions or anything to add, Scott, and
That sounds pretty much.
Yeah, nice job of explaining what we did for 2 hours. Doctor, you have got a request of you.
yes.
Okay. As we step back and look at healthcare in this country, in the state, in our region, right here in our own backyard, there's so many challenges and there's so many opportunities, and a lot of good people that really want to go ahead and put their shoulder to the wheel and try to make something happen. Would it be appropriate if I ask you for our next Board of Health meeting to come back with a list of priorities that align together, so that we're not spending a lot of meeting times going this way and going that way and not getting the results that we really need to get? Does that make
So
sense?
it does make a lot of sense, and I want to say that has been done by your community health improvement, the CHIP and the CHA, the different groups that we have pulled together in this community over the last couple of years. That was working very diligently with Mason Matters at the time. Put together a priority list. I would be very happy to bring that back and share it and see where we, as a bigger Board of Health now, that work has been done, and see where we see what progress has been done, and
Sift it out,
where
reprioritize
what
things.
else
Where
we
we
need.
can make a difference.
Yeah.
Yeah.
I mean, it has been done. It's always interesting to me when we talk about groups of people getting together and making a priority list, is the list gets there and action happens when somebody takes it on. So we can list something as a priority, but if nobody is willing or has the capacity to take it on, then nothing happens. But it is part of the discussion that we had about the dashboard. And when we put something like that on a dashboard, it can be seen by others that say, I want something to do. What can I take on? And that may end up perking somebody's interest and saying, oh, nobody's working on this. Well, that sounds like a great thing for me to get involved in. And as I always say, public health is not the work of the few staff members that we have in our department. It's the work of the community to make each other's lives healthier. And there's a finite amount of capacity within our department to do that. But it is getting that information out. So I thank you for that. We will try to bring that back up, and then just, laying it out. Where are we at? More of like a state of the where are we now
The priorities. Great.
with what we've done.
Good. Look forward to that.
Yeah.
Thank you, Doctor.
And I look forward to, I'm looking over at Lydia, because that's where the CHIP and the CHOP, the groups that have worked on it for years. And I think you were all in on the tail end of that. So.
I wanted to ask a question,
Terry.
if I could. So you talked about the RFPs being released.
CPAAR.
This-
Right,
That's
and
because
so
of-
one of them is the EMS post-op follow-up program that was piloted by Mason General. Will that be one of the RFP options?
I have no idea. It
Do you
will,
know?
it will be coming up next week, so we will see.
Oh, so they're not out
Here's
yet.
a sketch on how it's gonna look. So, you have the 6 focus areas that CPAA has selected. If public health, just our office, applies for one thing, it stands less of a chance of going through because it's not coordinated with the community. So if the community tackles 3 things, the whole project scores higher in the matrix. But if we have something like opioids that wants to be that we want it to be a focus, it can have special consideration given the importance to the community. So they're not writing out single projects, but they're encouraging us to roll those projects together in a coordinated way. So it'll be interesting to see what the language actually looks like when it hits next week.
Well said. It's complicated.
It is, and I've been working on this
Dave
for.
did a good job of boiling it down for us.
We've been working on this for months, trying to decipher what the healthcare authority was really trying to get to
Yeah.
through this Medicaid transformation
Yeah.
work. And where it gets more difficult is because the Medicaid transformation work is really geared towards Medicaid service delivery.
Mhm.
But it won't be successful if you don't have the upstream services of public health working to keep people out of that system in the first place.
Mhm.
So we're trying to thread that line through there of where public health has a vital role to play in the system and try to get the funding to do it along the way.
And I just wanted to make a comment. I think it's essential that you add the Squaxin tribe at least. I was speaking to Councilmember Whitener not too long ago who said that they're pretty seriously looking at building some sort of healthcare delivery complex modeled after the Jamestown S'Klallam tribes.
I just reached out to them this
Good.
afternoon, and
Good.
I was just saying that their health services director is actually leaving. She's retiring, so, but I put in, it's on my to-do list is to contact the tribe. So,
Thank you.
I've done that. And I will continue to pursue that. Thank you.
Any idea what they think that's gonna look like if we stand it up?
Just, I was told to go see what they've got going on at the Jamestown S'Klallam. So, I've not seen their level of service, the depth and breadth of the services offered. So,
They've got a-
So what I'm hearing is it's going to be an FQHC model.
okay,
So with integrated primary care, dental, pharmacy, and substance abuse,
okay,
and under one roof, much like Peninsula.
okay.
So it's
Yeah,
really
it's a
an effective and nimble way of doing business, especially with small Medicaid populations.
Okay.
But I think it serves more than just the tribal numbers. It serves the community as well, I think.
Yeah, I don't know.
Good. More to come. Anything else, Jay? No, just that,
That's it.
that does it, okay? Thank you. You have to leave here now. So feel free
No.
to,
I've
you're
I've
good.
got time.
Okay. Remember I gave you the opportunity. Lydia?
Okay, so, you all received the manager's report. I'm not gonna go through it today because my team, the opioid response team, has come to give some presentation to all of you and kind of update you on what's been happening with our opioid response plan in Mesa County. I did wanna briefly mention, last meeting, I talked about the Emergency Preparedness Coalition 3, the regional coalition, and how they were changing the structure and they had divided 2. So we had a meeting back in April. Our next one is in another 2 weeks, and we'll update even more next meeting. But it seems that the organization they've chosen to do the coalition up in Seattle, we met with them at the last meeting. They kind of shared what their vision was. And what we're hearing now which we weren't hearing before, is that the coalition will remain. So we will continue to meet as a coalition, which is a good thing. We'll learn more at next meeting. That they will be handling certain things, but they'll be looking to our regional coalition to be able to get information, which kind of makes sense to us. We didn't quite understand why that was going away. So I'll fill you in after next meeting as to actually what the details are, because that's going to be hammered out with our executive committee and our membership next meeting. So just wanted to update you on that. So then I'm going to invite up my staff. I'm going to start with Allison. So remembering that our Dr. Yu actually began this whole opioid response in Mason County in the end of, well, summer of 2016, when Department of Health offered us some funding to do our prescription drug overdose work in Mason County, and that's kind of what sparked off. And then the health department pulled together a forum at the high school, and we got a really great response from the community. A lot of education went out, kind of got things rolling. Then we finally got our prescription drug overdose, which we call PDO, and you'll see it up there. That is our state grant that we have for 3 years, so we still have it for another year and a half, basically. And they're going to talk a little bit about that. And then moved on to partners getting more involved. North Mason County stepped up and hosted a second forum in 2017 that was well attended, and more information and more excitement. And so lots of things have been rolling along, and we're excited about it. My staff, this is the group. They're not all working full-time on this, but 2 of them, that is their main job description. The others have other positions that they do, but kind of wanted to bring, I heard we needed more information, so they thought they'd come and bring you up where we're at to date.
Great.
So my name's Allison Smollett. I'm the health educator with the county, and I'm just going to start out with, at the direction of Dr. Yu and in collaboration with the environmental staff, we put together a safe syringe disposal video for the county so that people could see how to safely dispose of syringes. So I'm going to play that real quick for you guys so that you can see what we've put out there. And it went out on April 18th, I believe. So it's been out for a couple weeks now. So we'll play it. And let you guys view it. Where are you going to go? If it'll buffer.
Hi, my name's Katie, and I work for Mason County Public Health. Finding a syringe in your neighborhood can be quite concerning. Teach your children to not touch the syringes and go get an adult for help. Luckily, with a few household items, syringes can be disposed of safely. Let's go over the steps.
It actually works well on YouTube.
Sorry.
It does. And it's on our website, too. It's
Yeah.
on our website.
Let's see, we'll try it again, see if it had some time to buffer on that one.
See, you didn't know Katie was a ventriloquist on top of everything else.
There you go.
You should have said, that's the way you can pick up, oh, he's on here.
Hi, my name's Katie, and I work for Mason County Public Health. Finding a syringe in your neighborhood can be quite concerning.
Darn. All right, we'll just let it buffer for a moment. Sorry.
Into
The staff one too.
Okay.
Not even guessed.
Will you act it out for us, Allison?
Teach your children to not touch the syringes and go get an adult for help. Luckily, with a few household items, syringes can be disposed.
So basically, if you watch the video, it just shows you, she talks for a few minutes, and then she shows you how to pick up a syringe that you find and how to dispose of it. And it's a short video, and
It's 2 minutes.
What's good about it is it's very real life, and somebody can just say, I found a syringe, here's a video you can look at, and here's how you can do it.
Yeah.
Use as household items, you don't have to have special stuff that you need to get.
Sorry, guys.
And,
Would you be able to send us a link?
Absolutely.
that works.
Yes. I know, I tried to send.
So what do you use to put it in?
a rigid container like a detergent bottle, like a Tide bottle,
Okay.
anything with a screw-on lid, or a kitty litter box
Okay.
works as well.
So it's just making sure that you seal it, that the components are a
Rigid
rigid
container,
container,
screw-on lid.
duct tape, and a Sharpie.
Yeah, and
Okay,
duct tape
because
and a
you
Sharpie.
wanna duct tape it shut, and you wanna have a Sharpie to say, do not recycle, because it's a recyclable container. So,
So we'll let everybody else do their presentation, and maybe I can go to the website and we'll play it from there. Maybe it'll work at the end. So we'll try that. G.
Oh, is it? Yes, it is.
okay.
Switch.
Okay, so just updating you a little bit on the syringe exchange where we're at, since we brought it to the Board of Health a while ago, a couple of months back. So our messaging is that we've been doing in the community is very much public health does not encourage or advocate for drug use just because we're doing a syringe exchange or looking into it. And we've got great feedback actually from the community. AID's been out talking to literally everyone, all different agencies, explaining so that people really understand what it is we're doing in public. And the feedback has been very positive. I don't think we've actually had any negative feedback. And so now we're in the process of applying, looking for funding for different things. So we've kind of had Squaxin Island Tribe has mentioned that we could apply for some funds, and we've done so already. We're waiting to hear. The CPAA, which Cascade Pacific Action Alliance, is the healthcare group in our region that we just talked about, those funds that are coming out. We're putting things in place to be able to apply for some, and actually they encouraged us and reached out for us to apply for the syringe exchange. So we're definitely going to do that. They asked us to broaden it, so we'll definitely be talking with the hospital and other organizations to see what else we might be able to put together, although frankly the amount of money wasn't that much. So I was a little concerned about that. But
Should we talk about that a bit?
about the money?
I'll come back to my report.
Okay. And then Department of Health, we have talked with the Department of Health. They supply funding for supplies only to different counties, and so we have already put in information requesting, and they're going to start us out with some. They've agreed to that already. So we have a little bit going there, and we're hopeful, since CPAA kind of reached out to us, that they're interested. Having a syringe exchange, what we're discovering in information throughout the state and the nation is that it's really integral to doing an opioid response plan and a drug treatment and things, because it's where you actually connect in with active people using. And so we do need to have spaces and places where we can make that connection, bring in providers to help share their programs and encourage people and help them want to be able to participate in that. So we're real excited about that. So any questions on that? It's kind of brief. We're kind of in a holding pattern till we get a little bit of money here. Nope? Okay. I'm turning it over to Christina.
Hi. So again, I'm Christina Muller-Shin, and I am the Community Services Opioid Response Team. I'm funded under the state PDO grant, so the Prescription Drug Overdose Grant. And today I'm going to give a very brief overview on overdose and how to use naloxone. We thought it would be kind of fun to give you a snapshot of what we're actually doing in the community. So naloxone, and I have a little sample so you guys can actually see it. We give out the intranasal spray. So it's very user-friendly, very kind of intuitional of how to use. And naloxone only works to reverse an overdose. There's nothing really else that this does. It's a very safe drug. What did I say?
Opioid.
Opioids.
Opioid overdose.
Yeah, opioids only. It's been used in the hospital settings, medical settings for a very long time. Washington has a number of laws protecting people from using this. It's called the Good Samaritan Overdose Law, and I have a handout I'll be passing out afterwards, which has some of the kind of legal jargon, so you can really see the extent of what that covers. But some things that are notable, it allows anybody to obtain naloxone and administer it, so it takes liability away from the individual. And it also allows naloxone to be prescribed to an entity such as police department or a community service in order to allow them to use it and be protected as well. We'd also like to note that currently all of Mason County Sheriff's Department, Shelton Police, and the Department of Corrections field officers have all been trained on naloxone and all carry it right now. And it also protects the overdose victim and the person assisting the overdose from misdemeanor drug possession. So that's been a really major one in allowing people to feel safe calling 911 when there's been an overdose situation happening. So to recognize an overdose, you want to kind of look for an individual who has very labored or no breathing. Oftentimes the skin is very pale, the lips turn blue, the fingernail beds turn blue. Often if they are still breathing, you'll hear kind of this gurgle, snory noise. And lack of consciousness. So these are some of the things that we want to look for if we see an individual we think might be in trouble in the public, to help determine whether or not they need intervention. The bottom line is that if they're unresponsive, they do need medical attention immediately. So the first thing you want to do is try to wake them up. Call their name if you know their name. If not, you can do a sternum rub. So you want some kind of pain stimulus to shock them into waking up. So the sternum rub, you take your knuckles here and rub it really hard on the chest plate, really, really hard. And you can sometimes get people to wake up from that. If they're still unresponsive, you need to call 911 immediately. In fact, before you do the sternum rub, I would suggest calling 911. As soon as you find someone unresponsive, please call 911 and then try to wake them up. So if the sternum rub is not effective, you're going to go ahead and administer the naloxone. So you're going to take the nasal spray and spray it in one nostril. It does take 2 to 3 minutes before it works. If they don't wake up in a couple of minutes, you're going to administer the second dose into their other nostril. So each box comes with 2 doses. And this is usually enough to wake them up. We have seen, especially with the rise of fentanyl, sometimes it's taking multiple doses to wake people up, sometimes 4 or 5. And since opioid overdose is a depression of the respiratory system, if you feel comfortable, please administer rescue breathing. It only takes a few minutes of not breathing before brain damage can occur. And the naloxone only works in the system for 30 to 90 minutes, after which it wears off. And they can overdose again afterwards. So it's really important that that person gets transported to the hospital and can be supervised for a few hours before they're released in case a second overdose happens. And so if you want any more detailed information on this, we have a number of trainings. I'm doing one in Belfair tonight at 7 p.m. at the library. You can also meet with me or Abe individually if you want a kit to have on hand. And I think that's it. Any questions?
Can you pass that around?
Yes. So I'll pass out the naloxone, and I also will pass around my Good Samaritan overdose laws. I found professionals are very interested in the intricate of the laws.
Yeah.
I forgot. So while you're looking at that, I'll just give a little bit rundown of what I've been doing since I've been here in January. So the light pink is 2018, the dark watermelon is 2017. So far, we have trained 121 individuals on how to use naloxone, how to recognize overdoses, and the community resources that are available in Mason County. And we've given out 291 naloxone kits into the community. We've been doing a lot of trainings to treatment providers, to agencies that are working with high-risk individuals, and a lot of the members of the community, whether they have a loved one who's an opioid user or not, I've gotten very positive response.
Also a reminder that folks can pick up a naloxone kit from the pharmacy without a prescription. Well, because the prescription's already there through QFC and Belcare.
I think Safeway and Rite Aid also.
Safeway, Rite Aid, and Neil's Pharmacy
Mhm.
down here. So you don't need a prescription, you just walk up and say, I want a naloxone kit, and you can buy them.
Mhm.
You give us some statistics on the number of patients that you're seeing that are being saved?
Yes, is the next
That'll be
slide.
the next one, it's coming
Yeah.
up.
It's coming. Go ahead.
So, yeah, I did have a question. What's the shelf life on naloxone?
18 months.
18 months, yeah.
Okay.
And so we are, every time I talk to someone, I'm telling them to be aware of that expiration date. You also don't want it to be left in any extreme temperatures, so you don't want to leave it in your car during the winter or the summer. So we give all of this information, and then people can come, if it's expired, get a refill from us.
I'm Audrey O'Connor, and I'm the public health nurse at Mason County. One of my jobs is collecting the data that we get on opioid overdoses and deaths. Here you just see a simple bar graph, 2017 data and 2018 data to date. In 2017, we had 16 opioid overdoses, non-fatal overdoses, and 5 fatal overdoses. So far this year, we've had 11 reported non-fatal opioid overdoses, and we've had no fatal overdoses to date. So it's just a snapshot, but you can clearly see that we're making a difference getting that naloxone out there.
And then remembering this is reported. Right.
Yes.
There can be a lot happening that aren't ever reported.
And we're getting really great cooperation with fire, police, and sheriff department getting reports in when there isn't, and the hospital with Mason General is sending over overdose reports when they are happening. So we're getting really good partnership and cooperation throughout all the agencies to get that information. Kevin?
Excuse me, does Harrison report on those for Mason County residents that end up going to Harrison, the north end?
If they are Mason County residents, if they die, that we would hear about them. They would probably get reported to, if that happened in Kitsap County, it would be reported in Kitsap County.
But it is not, currently not reportable in Kitsap County. So the way I view this is if the event is occurring in Mason County, oftentimes they'll call 911 and our EMS will report it, even if they transport them to Harrison. But it's if somebody, and the more naloxone kits we have out there, the more opportunities for people to actually use it and rescue, and they may not necessarily call 911. So we would not have any idea about those until the person who's gotten the kit comes to us for a refill. Then that might be another way for us to find out that they had participated in saving somebody. And then we would get the data kind of backwards. It's a very interesting dynamic. I had absolutely no idea what we were going to end up seeing when we asked to make it reportable. And the first week we made it reportable a year ago in March, we had like 8 reports that I was floored. I was like, oh no, too many. We don't have the resources to take care of it. And then we had no reports for months. And then, and part of it was miscommunication. And so then as we worked on that, the more Abe and Christina went out, then, you know, getting an understanding, and frankly, working with Chief Bakken has been great. You know, it's been a great help for us. getting the word out and getting the reports in. So the other thing is the overdose, non-fatal overdoses, that number may not be very accurate because it just reports. The deaths will be pretty accurate because that comes to us through the coroner. Okay, so that is a number that I would trust being a true, and there's a delay of 6 to 8 months because that's how long it takes for the drug tox screens to come back. But eventually we will get that number.
So, Dr. You and I both look at every death certificate as it comes through. So they get reviewed by clerical staff, and then Dr. You and I review them for other things, so tracking trends, ages, diseases, those sorts of things. Not just the specifics of the certificate itself.
Thank you.
Thank you.
We get to see all my team today.
Good.
Abe Gardner. I also work for public health, part of the opioid response team. I'm working on the Comprehensive Opioid Abuse Program, or the COPE, and it's a federal grant. We kind of officially started work on this March 1st, so it's just been a couple months. But there are two main parts to this particular grant. One is a data collection and external evaluator piece. We've worked really hard at coming up with a data collection form, a standardized data collection form that we're engaging with our treatment providers here in our community to get some information to see what our recovery and treatment system looks like, so we can assess, the effectiveness and or inefficiencies of what's going on in our community. The second main part of this grant is looking at our treatment and recovery system comprehensively and looking at the systems of care that we have in place. Based upon the momentum that kind of started back in September of 2016 at the forum, and then the forum we had in North Mason in October of last year, and people sitting around the table and really having some discussions. This is going to allow us to formalize some of those partnerships that have started through some MOUs and letters of support. So right now we have about 10 agencies that are treatment providers, substance use treatment, recovery services that we've been in discussions with and that we're wanting to bring to the table. And we have 17 and counting other community agencies, hospital districts, our therapeutic courts, our law enforcement entities, our tribal nations. So really trying to bring everyone to the table and have some discussions. The goal for that is to really create a no wrong door approach for the utilizers of the system. So for the individuals that are actually receiving the services and or anybody accessing it, whether it be a family member, a loved one, an agency, to really shore up any gaps, identify barriers, and to work in solution. So we're really excited with where things are right now. The community's been very receptive. So far I haven't been met with any no's. We're not going to participate. We're moving forward. The next step is to get some of those signatures and start collecting some data over the next month or so, kind of a trial run, and with an official start being July 1st. And the idea is to do one meeting a month with all the decision makers at that table for the first 3 months, and then move forward doing that quarterly. So being able to share data up to date and really talk about what we can do to best benefit our community. Any questions? All right, thank you for your time.
We can try the buffer.
Oh, these are our samples that we let people hold.
Hi, my name's Katie, and I work for Mason County Public Health. Finding a syringe in your neighborhood can be quite concerning. Teach your children to not touch the syringes and go get an adult for help. Luckily, with a few household items, syringes can be disposed of safely. Let's go over the steps. First, you're going to need a rigid container, such as a detergent bottle with a screw-on lid. Next, you'll also need gloves. You can use medical gloves, and if you don't have medical gloves, you can use kitchen gloves or gardening gloves.
We were doing so
You'll
good.
also need something to pick the syringe up with. We recommend using needle nose pliers, but you can also use tongs or a napkin if that's all you have. You'll also need a permanent marker and some duct tape. It's important to take the container to the syringes and not the syringes to the container. Wearing gloves, place the container on a flat surface and remove the lid. With pliers, pick up the syringe in the middle of the barrel with the needle facing away from you and place it in the container, needle first. If there are lids such as these, use the pliers to place them in the container as well. Once everything is in the container, take the lid and screw it on tightly. You're going to take the duct tape and secure the lid, wrapping the tape around. Once the lid is secure, you're going to mark the bottle, sharps, do not recycle, with your permanent marker. After your container has been labeled and secured, you can throw it away in the regular garbage. It's safe and legal to dispose of them this way. Thank you for helping keep Mason County safe and healthy.
Did you love the background rain?
Yeah.
It was pouring that day. Absolutely pouring.
So were we unable to get Tide sponsorship?
No, unfortunately.
I didn't think about that.
All right. Good to know.
Thank you, Lydia. Great. Dr. Yu, it's, you mentioned it to me, so I'm gonna.
I got my clarion call here. Thank you very much. We'll see you next month.
Look forward to your report in 2 months.
Yes.
Okay, Dave.
Okay, thank you.
Please.
So in my report, I talk about finances and some of the grants work that's going on. So I'm just going to build on that a little bit. With CPAA, we've been working on this Medicaid transformation grant process. We have the grants are going to be released. The RFP for the grants is going to be released. We're going to be selecting between 35 and 45 recipients at about $45,000 to $49,000 each. So it's not as much money as what we had hoped. So we're going to have to be smart on how we use that money. In some ways, if we can partner and pull a couple things together, we can make a little more traction with that money. The first 2 years, we're going to be paid for reporting, and the next 3 years after that, it's paid for performance. So
it's that much per year?
Per year.
45 to 50,000 a year.
Yeah.
And we're in the second year.
Well, really, we're going to be in the first year of funding. Now, other funding has come through to build the backbone with CPAA and do the outreach and get that, staff up to speed. I think they've got 11 new employees working through the different work groups. So you've got a lead for coordinated care, a lead for opiates. All those different pieces have their own leads, and they're working with the work groups to try to pull all that together. There's more work groups than you could possibly attend. There's just a lot of things. So we've picked things. Dr. Yu is working on the opioid process here locally. So we agreed that I would work on the opioid piece at the CPAA and regional level. So if we can coordinate those two pieces together, maybe get a little more action down in Mason County. So that's how we've divvied up the work. Other grant money that's coming out, we had talked about in my mind as well about the prevention grant, which we've had in the state for years. We had 10 years on the prevention grant. It's about $1.9 million. It has been going to chronic disease in the form of smoking prevention, obesity, diabetes, and the CDC came out with not a suggestion, it was stronger than a suggestion, that Washington State move that money over into infant mortality work. And it's interesting to me that the recommendations in the infant mortality report say that the 3 things you can do that most affect the health of a child: smoking, diabetes, obesity. So it seems like an odd circle to get back to the point where we're already trying to get to. So we're meeting with DOH this next week to talk about that, to say, you know, and they're looking at only 2 populations. They're looking at African American and Native American Indians. So it's just 2 populations, and reducing the number of grantees from 9 hubs to 3 communities. So our infant mortality rates are very good here in Mason County, so we really don't stand much of a chance of looking at that money. We haven't been getting the money in the past for the prevention grant, so it's gone to other communities. So it's not a loss to us, but there's no gain to us for that either. That's kind of the way the funding is going. It seems like public health is being put into a slot where we're not that governmental public health partner like we've always been. We're in the same category as other groups, which would be Lung Association, Heart Association, other non-governmental organizations. So we're meeting with DOH senior staff Tuesday in Ellensburg to talk about that relationship and is it changing, and how we can get back to being more of a partner with DOH on really what this Medicaid money is not doing. It's not. Let me back up. So the Medicaid money originally came down from the feds. They said we're going to take $4.2 billion out of Medicaid delivery, and we're going to move it over into social determinants of health to try to keep people healthy in the first place. Went to the Healthcare Authority for implementation. The Healthcare Authority really is focused around medical delivery, so it got moved right back into delivery services. So as you look at the projects that we're doing through CPA, they're really very delivery centered. And the push that public health is trying to make is that, well, that's good. It's good to do that. That money is pulling people out of the river. We're trying to go upstream to keep people from falling in. And I think the cost savings are really in keeping people out of the system in the first place. That's where we're actually going to bend the cost curve on Medicaid spending. So the focus that we're going into the summer with is how do we get to a place where that's recognized and funded. So it's a difficult road to try to get that thought process turned at a state and regional level. We're going into this next legislative session with a $60 million ask with the legislature, and it's going to be focused around communicable disease and environmental health. There's been some pushback to say, well, why environmental health? They're fee supported. Well, some of environmental health is fee supported, but if you're doing lead investigation, you're doing bats, bites, norovirus in the water, you're doing all those things, there's no funding that goes along with that investigation piece. And not only that, it's kind of a double hit, because if you're investigating a food outbreak, you're not working in the program that you can bill to. So you actually wind up paying twice. You're not getting your grant money, and you're having to go into your reserves to meet those obligations of the investigation. So we're trying to find some money to shore up that piece of the program, so we have some assurance that if we have to do investigations, there's money available to keep us afloat. In 2012, we had an outbreak of pertussis on the Friday before Memorial Day weekend at a daycare with 50-some kids.
Ooh.
And over Memorial Day weekend, we had to track down all the parents, family members of those kids as they scattered across 5 states, and then do get antibiotics to all those folks. It cost $80,000 in staff time to track that, and well, it's 40,000 staff time, 40,000 in lost grant time. So it gets expensive really quick. That's in the course of a week. So we're trying to find some money to shore up those systems and have that in the back pocket in the system, because it's really a weak spot that we have. Otherwise, it falls back on the counties to fund everything. all those pieces. And we know the county has difficulty funding those, and it's not just Mason County, it's every county has the same problem. So that's what we're working on in Ellensburg, that's what we're gonna be working on over the course of the summer. I take over as chair of WASALFO in a couple weeks in Spokane. So my job is to try to get that $60 million ask through the legislature this next long biennium session that's coming up. So we'll be starting that outreach work to legislators this summer and hit pretty heavy in the fall. So it's part of the Foundation of Public Health Services work that we've been doing and saying, all right, of all these things we can do, what are the things we have to do? And of those things we have to do, what can we fund? And really kind of focus in on those really important, really critical things and get funding for those. So that's a lot of what I'm going to be doing over the summer and this next year is to try to shore up that fundamental funding for public health in a way that doesn't impact the counties with kind of an unfunded mandate. So that's a lot of what we're working on. Plus working on with Mason General and with our local partners to get this process moving forward. I apologize for missing the meeting. I was working on some planning certifications I had to get done as well. So juggling a number of things. Yeah.
You'll be at the next one.
Yeah, absolutely. I'm really encouraged by what I see because I see us going down the same path that Pend Oreille County went down, in that you're pulling the decision makers who are able to dedicate resources in terms of people or money into this problem solving and getting away from let's just chase grants, because then you're chasing whatever the grant feels is important. So let's take our own resources as a community and apply those things to the problems we know exist, and we can start knocking them down.
Perfect.
So I'm really behind that.
I think that's the long term. And the short term, that's what it's about.
I think so too. We have resources, let's put them together and
Yep, combine them and stop tripping over each other.
combat multipliers.
Yes.
So,
Good.
moving forward. And that's what I have.
Okay, the last meeting, we talked about the syringe issues, and are we bringing that back today for more discussion?
Well, we're looking at the grant funding.
Yes.
That's where we're gonna have to go. And the grant funding is not as much as we had hoped, but we won't know really until next week.
Yeah, we're in the holding process, like I just said, for syringe.
We're just kind of,
We've got to get grant money.
Okay, so if we don't get the grant money, what happens to the syringe idea?
We keep looking for funding. That's basically how we fund these things. You have another idea, it's great.
Well, I was more optimistic hearing Dr. Yu talking about the success of some of the other counties in our region and how they were doing it. I guess I'd rather really try to beat that drum and make sure there isn't any other options before we just throw our hands up and say, we can't do this.
Oh, we're not throwing our hands up. We'll keep pursuing because we want it here.
But I didn't mean that in a bad way. I meant, there's no grant money, so it gets moved off the front burner onto the back burner.
Now, this is all part of our opioid response plan, and I had said it's key to our opioid response, so we've got to pursue and keep pursuing.
and if I may, I got a chance to look at the governor's. So the first proposal to the governor's budget, based on governor's priorities, so it's kind of a back and forth thing with OFM and the governor's office. And opioid and mental health are the top two things on his social services to-do list.
Good.
So the inference there is money will be available in all communities because he wants to make it a statewide outreach. So the scramble comes, and what we're pushing for is a base plus. So each county would receive a base to do opioid work, and then population based beyond that.
Right.
Because in cases where it's just population based, we always come out with just not enough money to actually do the work. So we're trying to work on that funding formula.
And the infrastructure is always going to cost the same whether you're in King County or in Mason County, so that's just absolutely doesn't make any sense.
Yeah.
I think in terms of syringe exchange, it's certainly a continued priority for me as well, and I think we'll have a little bit more clarity here in the next week or so, and then I think the plan was to bring it back to the commission and have a conversation at that point, and, you know, we can maybe explore other funding
Well, and I did meet
opportunities
with,
at that point.
I did meet with CPAA's opioid lead in Spokane a month ago.
Okay.
And we had a long dinner meeting, and we're really on their radar screen as our syringe exchange needs to go forward. So
Okay.
from the lead and from Vinfrey, they want to make this happen.
Mhm.
So as we were going into setting up the criteria for projects, I brought this forward as an example. Here's a great project, but it doesn't meet all those 6 project areas. And they did a carve out for special projects, and that's where I think we'll wind up, is a special project for CPAA. We'll see what the funding for that looks like.
So we're gonna put this back on the agenda for next.
And I think if you just leave it on the agenda.
Yeah.
Good. Okay. Good report. Anything else, Dr. Shadley?
That's it for now.
Okay. Any public comment? Yes, sir.
Good afternoon. My name is Tom Davis, and I work with veterans in the criminal justice system here. I'm the only public here, so this is my moment. As you know, or maybe you don't know, that we're proposing a tiny home village for veterans only to be constructed in the city of Shelton. And as you also know, funding is always the big bugaboo here. We approached this a little bit differently. We went for funding first. We were broad in our description of what we wanted to do, and we were fortunate enough to get some friendly ears and funding, both for the Shelton project to the tune of $3 million, and for the Ording project, an additional $3 million. Both projects are specific to veterans, although I always considered that something of a launching pad from which we would grow, because the sentiment right now and the resources are with veterans. It is always good to strike while the iron is hot, and then when you build on the success, you have a better chance of expanding into the general population. We're a brick and mortar solution. We're not, we don't have a lot of pie in the sky ideas. Our ideas are based on building tiny homes and putting people in them. So there'd be a performance measure that is readily apparent. We fill the 30 homes, so we would have a 30 home capacity in the way it's structured right now, or being proposed right now. With a couple of problems that we ran into that I'd like to advise the committee is, that I hadn't anticipated, was when there's a lot of money on the table, and it comes back, quite frankly, we walked the halls of Olympia, and we were successful in getting the money with the help of Senator Tim Sheldon, who basically held our hand through the process. But we ran into some opposition in the way of people who started to question the project, question the need for the project, question the money and possibly the language, how the appropriation was written, and all the things that I really hadn't thought about. I thought as someone who goes to the Housing Coalition meetings and so on, a win for one of us is a win for all of us. And so I know what money's tight, and these conversations always seem to circulate around money and around funding. But it shouldn't be the end all. The funding is a means to an end. It is not the end. And so when somebody is successful in securing that funding, then it brings them that much closer to the objective of this group. So what I would like to see is a little bit more support. And more specifically, right now we're talking with the city on a particular site. The city, up to very recently, has been very accommodating, but there's been a couple of concerns thrown into the process. There'll be a meeting at the city on the 29th. We have very strong support from the new council members, and we're very encouraged. But we would like a little bit more in the way of smooth sailing, because we're ready to rock and roll. And as soon as we get the site, we're ready to move on it. So, and the sooner the better. So anyone who could see their way clear to attend the city meeting, and Kathy, is it at still 7?
It's at 6 this one,
so
because it's a
change
special
it.
meeting, yeah.
It's a special meeting at 6.
Yeah, 6.
We would actually very much appreciate people coming down and speaking in support of this, knowing that this is only the first step on the ladder to solving homelessness in the general population in Mason County. This particular project is specific for this particular population, for this particular location, or something that is close to that location. But again, it is the first step in a long ladder, and we would be very, very privileged to support other people who springboard off this project when it's successfully completed, in their projects to meet that homeless need in the general population. But right now, we're the only show in town. We're the only people who are about to put one brick on top of the other, with the exception of maybe the triage center. All the rest of it is conceptual. All the rest of it is talk. So any support that you can give us, we very, very much appreciate. Thank you.
Thank you, Mr. Davis. Any questions of our guests today? Okay. Any other business to come before the meeting? Yes, Bo?
Just a quick question. The Healthcare Coalition, was Harrison Hospital part of that, or
Just the hospital district.
not the hospital itself?
No, but we were in they are being invited.
Perfect. Yeah, that was it.
Yes,
Perfect.
that was one of the people that we
Agrees.
said
Tried to
that
reach
we
out
needed to,
bring you.
yes.
Perfect.
Okay. Any other comments,
Sure,
questions?
I'd like to just share some information. Thank you, by the way, for bringing up the triage center, which is we're now calling the Evaluation and Treatment Center. Probably will be going to contract within the next week, and then hopefully build right after that, after permits is secured. It was delayed because of some new interpretations by the State Board of or State Department of Health regarding fire suppression in each of the rooms. However, you may or may not have seen that the governor is putting some money forward to alleviate or to answer policy change at Western State Hospital. In Eastern State Hospital, where they'll no longer be taking civil commitments, and it'll be forensic only, meaning criminally involved folks, with the hope to bring any civil commitments to back into the community. And so there's money out there. The Behavioral Health Organization has been asked by the Department of Commerce to apply for some monies. The second floor of that building, by the way, the first floor, we've managed to design it for 16 beds, and 2 we're hoping to hold off as detox beds. And we can't go more than 16 beds per our license. And then the second floor, then, we'd originally wanted to make it a full detox center because of the lack of detox beds, but Health Vest, who received a certificate of need in Lacey, has announced that they're going to have their whole top floor be detox. And so, because of the fear of having more detox beds than needed, our grant application will go in for 16 long-term care beds. And there'll be a mixture of involuntary and voluntary. And that would be in 90 to 100 days. I do want to reach out to each of the council members and talk with you folks about it, because I know that there were some concerns about that building in general. But the thought was that we have 32 beds between Thurston and Mason County guaranteed to us through Western State Hospital that we haven't been able to use for about a year and a half, and are no longer available to us. And so we'll all be scrambling for beds, especially Medicaid-funded beds. And so figured that was gonna be where the highest need is, and that's where the grant application will go to.
Do you have a site? Yeah.
It'll be the second floor of the PUD building. So the first floor will be for short-term stabilization and jail diversion. And with the idea that 3-day stay at the maximum, to then be sent out to, after being, going through court and hearing and assessed as being eligible for involuntary treatment. Then they'd be off to a long-term care facility. And so this would potentially be where they would go, or whatever beds are available, because these guys that work in this business, they're just wherever there's a bed, wherever there's a bed.
Anything the Department of Health, this board can go ahead and do?
No, we're feeling pretty encouraged. I am a little bit anticipating because of the concerns from some parts of the community about having the treatment center even in that location, that now with another level of care plan for the second floor, that there could be some community backlash.
But I would hope we would look at that with open eyes, because the truth of the matter is those are the same people that are already on our streets. If she's successful in a group in making it local beds instead of statewide, where it's Thurston and Mason County, we already have those people here.
Yeah.
They're already being affected. This is an opportunity to get them into a place where they may actually come out and get a life back.
Yeah.
and be a benefit to this community if they're able to pull off what they're working on. So I hope we have open eyes about it and realize it's not just not in my backyard. They're already here in our backyard. This is an opportunity to do something with the ones that are ours.
Good observation. Thanks for that.
Yeah. So yeah, what this Board of Health could do is just be aware, and if there are community outreach meetings, I don't know that we would need to do them like we did them last time, but that you know, to speak in support of it.
Okay, thank you. Good report. Appreciate that. Kevin, anything you'd like to
Yeah, I had a couple of upcoming events that I wanted to call everybody's attention to, and whether you can attend or not, I think there are some very good things happening in the community in regards to public health. So next, on May 30th, next Wednesday, I'll be attending a presentation at North Mason School District. Full disclosure, my wife is the nurse for the school district and has built a partnership with Olympic College in their bachelor's nursing program there. So they come in and do their community health projects in the high school and in the school district. And this year, the two groups that were sent to North Mason did a dental clinic at the elementary level, and then in the junior high level did a program on increasing resiliency and hope through peer connections. Which I'm really looking forward to that, as it kind of ties into the other event that's being hosted in part by our local Early Learning Coalition. June 15th, there's going to be a trauma-informed care and ACEs presentation, I believe at the Civic Center. They had funding to have, I think, up to 250 people come to the presentation and to the training. When I talked to Dan Tudeberg last week from our Washington State University Extension Office, they had 175 already signed up.
Wow.
So it's a tremendous opportunity to learn about an issue that I think is really kind of central to where we're headed in the public health realm, and that's trauma-informed care, and shifting maybe the paradigm from asking people what is wrong with you to asking what has happened to you. And learning more about their background, and especially with the adverse childhood experiences, that's kind of a critical component to what we're, I think, going to be trying to accomplish here in public health. So it sounds like there's still some room. If you're interested in that event, I would highly encourage it. Probably the second best thing about it is lunch is free. I know that's always a big deal for people. But I believe Dan Tudeberg at the Extension Office has some more information for people that are interested. That's all I got.
Thank you, Kevin. One last request of the board. How about some feedback? What would you like to see in future minutes? Would you like to see the agenda change? What would you like to see you can be more effective and do a better job at? You can send me an email.
I noticed that the 2018 minutes were not online. I found the 2017 minutes, but I was trying to
forward the 2018 minutes to someone who had requested.
Okay.
And so I wasn't sure if I was looking, but it was on the Mason County website, so that's something.
The January one should be there. The ones from March were just being approved today, and I have to change those, so they will not be on the list.
Yeah, I don't think January was
I'll check on it.
but yeah.
Good observation. So Terry sent me an email.
I will.
I'm gonna regret this, but you can't do it.
Randy will send you a phone call.
Is there a motion to close our Board of Health?
I make a motion to adjourn.
I'll second.
Thank you. Say that. Enjoy the nice weather.
You know, that today is my second anniversary. My very first day on the job was
With the
Board of Health
Board of Health meeting, that's
Oh.
right.